know, we have a lot of different treatments in the United States, and a lot of people, you know, the way they go is conventional medicine, and they're fearful of something that's new. What can we tell them that would make them feel at ease to come to some place that's new?
Well, there's a lot of issues on why someone would be resistant to coming to a clinic in the Bahamas or doing a treatment that their doctor is not familiar with. Well, that's part of it, is that if we could get the doctors, the oncologists and the other doctors that are working with the cancer patients back home, wherever home may be, to understand the therapy that we're doing and understand that you know, what it is, and just in a general sense, we'd like to form relationships, you know, so that with the doctors as well as the patient, so that we can work with them, because we depend, when the patient goes home, that they continue with their doctor, with their oncologist, with their surgeon, whoever it is that they need to see. And we need to get feedback on, you know, so we can know what we're doing right and what we're not. And you know, I think that if the medical profession knew a little bit more about, you know, what we're offering, I think that it wouldn't be so scary for the patients to realize that that they could come here. And then the second half of it is that a lot of times people have this idea that it's an either or, and unfortunately that's because sometimes people in standard medical care make it sound like that to the patient. They make it sound like, okay, well, if you decide to go off to this clinic in Mexico or Germany or the Bahamas or Colombia or wherever, if you go there, then I'm not going to treat you anymore. You know, and they threaten the patient with that. Why? Because you know they could even say, well, doc, look, you know, I'm doing 6 weeks rounds of chemo, and then I'm going to be off for a month. Why can't I go on vacation to Mexico or to the Bahamas or wherever and go to a clinic there and regenerate myself? Why not go to one of these clinics in Germany that, you know, specialize in rebuilding and restoring my immune function and my other systems in my body, you know, so that when I come back for the next round of chemo, I will be strong again and I'll be able to tolerate the chemo better. And maybe they have some treatments that will help, you know, the chemo work better. So in addition to immune augmentation therapy, there is this concept of chemotherapy augmentation therapy. There are certain nutraceuticals that we know will help augment the chemotherapy, so we need to know what type of chemo is planned for that patient when they return home, so that we can make some suggestions about which type of supplement program they can go on to help the chemo work better.
Okay.
So, you know, so there's no need to feel, the bottom line is there's no need to feel that there is a either or situation. That if they come here, they've abandoned their doctors back home or the medical system back home, or vice versa. You know, so that's one of the main points that I'd like for people to understand, is that it's not an either or. It's an integrative, advanced treatment philosophy.